Radio Nasha.
हेलो एंड वेलकम टू रेडियो नशा। मैं हूँ रंगीली रुचि आपके साथ एंड दिस इज आस्क मी एनीथिंग विद डॉक्टर मुंजाल। सो लेट मी टेल यू अबाउट डॉक्टर मुंजाल। सबसे पहले डॉक्टर मुंजाल कपाड़िया इज MBBS. He's earned his MS in Obstetrics and Gynecology from Maharashtra University of Health Sciences, where he ranked second in state. And after a lot of degrees and accolades from universities abroad, इन्होंने सोचा कि अब फैमिली का जो 7 decade लंबा लेगेसी है उसे कंटिन्यू किया जाए इन हेल्थ केयर। एंड इसी विजन के साथ में नमहा हेल्थ केयर एस्टैब्लिश हुआ, अ बुटीक मल्टी स्पेशलिटी हॉस्पिटल कमिटेड टू एक्सलेंस इन द ईयर 2016। इनके लीडरशिप में नमहा हेल्थ केयर हैज बीन recognized as the best emerging hospital of the year. And मैं ये मानती हूँ कि डॉक्टर मुंजाल कपाड़िया is anyway highly regarded, but effective director तो हैं ही, उसी के साथ में बहुत approachable हैं, patient friendly डॉक्टर हैं। once you start talking to him you feel like आप इन्हें कुछ भी बता सकते हैं। you can actually sit down and gossip about your सासू माँ also with him and he'll be equally interested.
More interested. I love gossip.
Oh, that's why we love you. Thank you so much for joining me here again.
Happy to be here as always, Ruchi.
बहुत सारे सवाल हैं जो कि पिछले कुछ हफ्तों में हमारे लिसनर्स ने हमें भेजे हैं, सो एक एक करके मैं वो सारे सवाल आपसे पूछूंगी. As
Sounds
it is,
good.
ask me anything with Dr. Munjal. So maybe somebody might just ask you for some new show recommendations and all of that.
Happy to provide it.
I know.
Yeah.
Okay, so the first question is not about OTT shows. It is about health. एंड सना ने ये क्वेश्चन पूछा है कि वो और उनके हस्बैंड देव बीन प्लानिंग अ बेबी, लेकिन बर्थ कंट्रोल पे वो बहुत सालों से रही हैं. सो कितना समय लगता है आफ्टर यू स्टॉप बर्थ कंट्रोल पिल्स टू गेट बैक टू नॉर्मल रूटीन इन योर बॉडी?
So this is a common misconception, Ruchi. लोगों को लगता है कि I've been taking this pill since 3 years, 5 years, 10 years. After I stop it, I need to let everything wash out of my body, detox from the pill, and then think of conceiving.
Correct.
This is incorrect. You can start trying the month you leave the pill.
Okay.
And surprisingly, not surprisingly, but surprisingly for the listeners, the months immediately after stopping are your most fertile months. हाँ.
Wow.
तो जैसे ही आप छोड़ो, उसके next few months are the ones where they will most likely conceive. So don't miss out on that. There is no need for your body to get rid of these drugs and these chemicals and these hormones. Absolutely not. Start trying right away.
डिटॉक्स करना है के लिए एक वेकेशन पे जरूर जा सकते हैं एंड मे बी यू विल कम बैक विद अ
I
गुड
mean,
न्यूज़.
like a mental detox is
Yeah.
great, but you don't need to do a drug detox. You just need to be happy, chill, don't overthink it, start trying.
लवली. नेहा ने बताया है, इट्स रियली सैड बट उनका मिसकैरेज हुआ था लास्ट ईयर एंड अब उनको बड़ा डर लग रहा है टू ट्राई अगेन. तो क्या प्रिकॉशंस लेने चाहिए आफ्टर एन इंसिडेंट लाइक दिस टू इंश्योर अ हेल्दी प्रेगनेंसी?
Okay, so there are many factors इसमें. The first thing would be what is the couple's age. Suppose they are on the higher side, say about 35, 37. Once just meet your doctor, meet your gynecologist or a fertility specialist, just to make sure कि भाई routine test में कुछ irregular नहीं है. If you are slightly on the younger side, say early 30s, late 20s, or in your 20s, nothing is to be done. 25% of all pregnancies result in a miscarriage, either known to the couple or unknown to the couple.
Oh, okay.
Sometimes you may even have conceived but bleed regularly on your period date. You never have even realized कि conception था भी कि नहीं.
अच्छा.
So what you have to understand is that miscarriages are part of trying, unless they are recurrent or happening at a time where, say, you're much, older, where the timeline is a little, shrunken for you. Nothing is to be done. Absolutely nothing. You have to tell yourself that this is nature's mistake. While development, something must have gone wrong. The body has recognized that something has gone wrong and have bled.
Okay.
Wait a couple of months, give yourself time to physically and emotionally recover. Make sure all your vitamins and all are in order. You're taking your folic acid properly. You've recovered well. Start trying.
All right. सिमिलर है थोड़ा सा, इसके आगे भी सवाल. इट्स रिलेटेड टू प्रेगनेंसी एंड फर्टिलिटी. प्रिया बोल रही हैं कि 1 साल से ज़्यादा हो गया है, शी इज़ बीन ट्राइंग टू कंसीव, लेकिन सक्सेस नहीं मिली है उन्हें. कब वो समय होता है व्हेन दे शुड गो एंड सी अ फर्टिलिटी स्पेशलिस्ट?
Now, So any couple who's been trying naturally since a year, but trying sincerely, where they have been tracking their dates, they know what are the fertile periods, etc. एक साल हो गया, it's not happened, you have to, as a couple, go and see a doctor.
Okay.
Suppose you're above 30, we reduce that timeline to about 6 months.
All right.
कुछ ज़्यादा करेंगे नहीं डॉक्टर. They will check the husband for his semen parameters. They will check the female partner for her AMH levels to make sure that her eggs and all are good. They'll do an ultrasound to make sure uterus and all is okay. Few other hormones like thyroid etc. करेंगे. Might help you out a little bit in terms of how to try. Maybe you're making some mistake somewhere. Get all of that cleared out. Suppose he wants to accelerate the process, he may give you certain pills, suggest some procedures to be done, etc. etc. But if you're trying since 1 year, wise to at least visit a fertility specialist.
All right. दिव्या का क्वेश्चन है. दिव्या says 40s में एक हेल्दी प्रेगनेंसी होने के क्या चांसेस हैं और क्या एक्स्ट्रा प्रिकॉशंस लेने चाहिए?
So the human body has been designed to conceive earlier in our when you're much younger.
Biologically, लेकिन
Biologically, we are designed to carry pregnancies when we are younger. However, it's not possible for everybody.
Right.
At Namaha especially, we are getting so many couples who are late into their 30s, even early 40s.
Especially Mumbai जैसी जगह पर because of our jobs, professions, it is so difficult to survive. हम ये लेट करते ही जाते
But also, why should somebody compromise on their career choices or their goals in life just because they want to have a kid or not have a kid? Yes. Few things somebody in their late 30s or early 40s should keep in mind is that yes, is it a little harder to conceive in your late 30s, early 40s? The answer is yes. And number two, is it going to be a slightly more complicated pregnancy? Maybe. All of that depends on how your internal health is. It might be easy for you to conceive if your AMH everything is very good, if you have enough eggs, etc. etc. Cycles are regular, you've been living a good life, eating well, exercising, thyroid and all nahi hai, diabetes nahi hai, high blood pressure. You may just sail through. But for most people, thyroid, high blood pressure, diabetes, falling AMH, other issues, small fibroids in the uterus, etc. Even for a male factor, declining sperm counts, poor, यही age group में आता है. So you must be a little cautious, but it's not that you can't have. So if somebody doesn't have a kid and says, I'm already 40, should I even bother? Yeah, definitely.
Yeah, if you want to, yes, of course.
With correct guidance, you will be able to conceive, have a healthy 9 months and have a healthy child.
Yeah, wow. जैसे Instagram पे ट्रेंड्स होते हैं वैसे मुझे लगता है कि हेल्थ केयर में भी ट्रेंड्स आ जाते हैं. एंड एक ट्रेंड मैं कहूँगी वो ये है कि हम सर्वाइकल कैंसर के बारे में बहुत बात करें और HPV वैक्सीन के बारे में बात करें. थोड़ा सा इसके बारे में बताइए कि कुछ लोग मानते हैं कभी भी ले लो, कुछ लोग मानते हैं देयर इज अ सर्टेन पीरियड वेयर यू शुड बी टेकिंग दिस. इज इट फॉर ऑल?
So the cervical cancer vaccine is called the cervical cancer vaccine in public. However, people को ये समझना चाहिए कि वो कैंसर के अगेंस्ट वैक्सीन नहीं है. It's a vaccine against a virus, which is the human papilloma virus.
HPV.
HPV, which is the same virus which can cause warts on your fingers, on your private parts, etc., etc.
Okay.
But it is also the commonest cause of cervical cancer in women. We strongly recommend that everybody take it.
All right.
Nowadays, of course, in our generation, it wasn't there when we were much younger, but now what we do is that as soon as a young girl gets her period, we give it. Because the best results of the cervical cancer vaccine are before you are sexually active.
Right.
However, taking it at any time, we use the upper limit of 45. Even if you've had your kids, not had your kids, have a single partner, monogamous relationship, don't have a high risk sexual lifestyle, it is still important to take it. What is the harm? 3 doses लेने हैं. There is no boosters later on. It protects you against not only cervical cancer but also having warts etc. for the rest of your life. So I would 100% insist that if somebody is listening, if they are in that age group where they are just either teenagers or just becoming sexually active or have just become sexually active, all the way up to 45, please talk to your doctor, and if available to you, if you can afford it, please take the cervical cancer vaccine.
Okay, the next question is from Suman. बहुत ही कॉमन जो प्रॉब्लम है जिसके लिए हम प्रिपेयर नहीं होते हैं वो है बॉडी के चेंजेस आफ्टर चाइल्ड बर्थ, और यही वो कह रही हैं कि चाइल्ड बर्थ के बाद टू हैव अ हेल्दी सेक्सुअल लाइफ इज बिकमिंग डिफिकल्ट फॉर हर। तो इसको कैसे बेटर कर सकते हैं, सेक्सुअल हेल्थ को कैसे बेटर कर सकते हैं?
Again, it's two parts.
Yeah,
You are not the same person after childbirth, either physically or emotionally.
correct.
Our body is not like a rubber band. You know, you stretch it for 9 months and suddenly post delivery will snap back into shape. No, it's not going to happen. There are going to be blemishes, there's going to be pigmentation, there's going to be stretch marks, a little bit of, no matter how much you exercise and diet, there is going to be a little bit of soft bits here
Yeah.
and there, which is fine. The first thing I'll tell somebody is that embrace it. This is a body that served you so well. It's given you a kid, it's given everything. So the first thing you need to do is not hate yourself. This self-hating, self-loathing is one of the main reasons why people just tend to withdraw. They don't like seeing themselves naked. They don't like, they'll switch off the light, which is okay, but it stems from this unreasonable expectation you have of your own body.
Correct.
If you've delivered vaginally or if you've delivered by C-section, it also changes your pelvic anatomy a little bit. So the same feeling you used to have earlier may not happen now. When you deliver vaginally, you may have had a cut down there or no cut down there. There might be some amount of scarring, etc. It may be painful for the first few times. The only thing I can tell the listeners is that you be patient. Think of it as a re-exploration of your sexuality in a new way.
Yeah.
Once you are happy with it, once you go slow with a cooperative partner, things usually end up falling in place. And most people will always tell me that, Doc, I'm having the best sex of my life in my 40s as opposed to my 20s.
Oh wow, great.
Yeah, no, it's true, because in your 20s it's more performative.
Yeah. Kavita says birth control pills के long term side effects पर बहुत बातें होती हैं, क्या ये infertility या hormonal imbalance का reason बन सकते हैं?
No, quite the contrary actually. So people believe that taking hormonal contraceptives will imbalance your hormones. Well, it's the reverse.
Yeah.
Most of the times contraceptive pills are given to make sure your hormones stay the way they're supposed to
I had the best skin possible when I was
on
them.
certain contraceptives.
Yeah.
Exactly. So same here. So many of my patients also tell me the same thing, that first they're very hesitant to take these contraceptive pills, especially girls who suffer from polycystic ovaries, etc. But once they start taking and they're so happy with their skin and they're like, Doc, no, I'm very scared of stopping
Correct.
it. Yeah. But there are some side effects that shouldn't be ignored. Most of them show up very quickly after taking it. Number one is nausea, acidity. People just feel uncomfortable throughout the day. They're like, I just don't feel like myself. I'm constantly nauseous. I can't eat. I can't focus. That's one. Change the brand, change the dosage. There are many options available. The second is, if you are somebody who is more prone to blood clots, etc. So if you're taking a long flight, frequent traveler, usually have a drink or two on the flight, don't get up from your seat, don't hydrate well. And if you have a tendency, they are sometimes more likely to develop blood clots in their legs, etc.
Okay.
So it's just something that I tell my patients, that you're on this pill, when you're flying to say London or New York, any long haul flight, don't wrap yourself up and just keep watching endless movies with a glass of wine. Get up, walk in the aisle, go to the restroom, drink enough water, wiggle your toes, squeeze your calves, get the blood flowing.
Okay.
Beyond these two, we haven't had many people complain too much about it. But recently, since the focus on mental health and people are more aware of how they feel day to day, some girls even don't cope well mentally with it. It's a small percentage, but a significant number of girls will come in, Doc, very weird, I was so low last month, you know, after I took it, I've just been not myself, like crying for no reason. I just feel weepy for no reason and I just hate myself. Then I need to weigh the pros and cons. Are the benefits of this pill for her more beneficial than how she's feeling, and kind of find a balance for her. So beyond these three things, long term, very few. I mean, कोई भी दवाई पढ़ लो, कुछ ना कुछ तो निकल ही जाएगा आगे. It will end in cancer and death.
Correct.
But you need to reel yourself into the common statistical problems.
Right. निधि बोल रही है, अगर आपको लंबे समय तक कोई कॉन्ट्रासेप्टिव मेजर लेना है, जैसे 5 साल तक कंसीव नहीं करना है, then what is the most effective birth control method?
If you are not opposed to taking a pill, The pill is the most effective.
For as long as 5 years?
As long as 15 years.
Okay.
So people abroad have been taking it since they're 17, 18, since they become sexually active till the time they want a kid. It's fantastic. It has the lowest failure rate. The only thing it demands is compliance. You can't say, aaj lungi, kal nahi lungi, parso lungi, I forgot, I'm careless. No. You need to be strict about it.
Right.
But if you're somebody who's like, I can't take a pill. This every day, khol ke, I'm out for dinner, I'm traveling, I can't take a pill. Then an IUD may be better. An intrauterine device like a copper T or a multi-load device, etc., put inside your uterus serves the purpose the same way. But something that you need to remember is that both the contraceptive pill and the IUD protect only against pregnancy. So that is okay if you're in a monogamous relationship and having safe sexual practices with one partner, you're married, etc. theek hai. But if you're somebody from this Tinder Bumble generation who has this opportunity to meet more people, have more partners, etc., then the pill is not enough. You need to also be on a barrier contraceptive where it prevents you against STIs.
Keisha says कि अगर family history रही हो of women with PCOD or thyroid disorders, later developing ovarian cancer, या history of women undergoing hysterectomy in their family, क्या इससे उनका भी risk बढ़ जाता है of experiencing similar things? And if yes, तो कैसे prevent कर सकते हैं, कैसे reduce कर सकते हैं?
Okay, I'll break it down a
Yes,
little bit.
please. There's a lot.
So with polycystic ovaries, we've seen it run in families.
Okay.
Okay. So if the mom had it, the daughter may have it. If one sister has it, the other may also have it. Degrees may vary, but we've seen it run in families. It's also that if the mom has not had it, it may have come from the father's side of the family as well. The second thing you said is ovarian cancer. Ovarian cancer is also genetically linked.
अच्छा.
Yeah. So if you had a family history of ovarian cancer, again wise to stay in touch with your gynac, get your health checkups done periodically, etc., etc. Third thing you said was agar hysterectomy hui.
Right.
The reason for the hysterectomy is important. If the hysterectomy was for multiple fibroids, etc., something that may run in families, you may also one day end up with it. You can't fight genetics.
Right.
The only thing you can do is be more vigilant. If somebody in your family has had a gynac issue, talk to your gynac about it. So he also looks at you with that kind of suspicion that okay, for this patient, I'll maybe call her once every year instead of every 3 years, just to make sure I catch it early.
Right. Great. Cynthia says 2 बार इनका pregnancy loss हो चुका है, which is really sad, and that happened due to gestational blood pressure. क्या थर्ड टाइम प्रेगनेंसी के लिए इन्हें ट्राई भी करना चाहिए कि नहीं ट्राई करना चाहिए, और अगर करना चाहिए तो किस तरह के प्रिकॉशंस लेने चाहिए?
It depends when she has missed her 2 pregnancies. If it all has happened in the first trimester, second trimester, or much later, like in her 9th month, if some complication happened, or if she had a seizure, or if the placenta separated, or if the baby just didn't have a heartbeat, etc., must have been very traumatic for her. However, there are tests to be done prior to conceiving again.
Okay.
If those tests signify that there is an inherent flaw or inherent abnormality, there are measures available which reduce the chances of you developing complications of high blood pressure in your next pregnancy. Will it suddenly prevent her from developing high blood pressure in her next pregnancy? The answer is no. We have seen that somebody who develops complications due to high blood pressure in pregnancy will again develop it next time as well. But with a little bit more foresight, दवाई पहले से अगर शुरू की जाए, there are certain injections like blood thinners that you take from day 1, it reduces the complication that will occur 7-8 months later. It may still occur unfortunately, but this is the only way to prevent it.
Okay.
Be in touch with your gynac from day 1, make sure that before you conceive he's seen all your tests and there's a proper program in place to try and prevent a bad outcome next time.
Lovely. So we all need to be patient but not become one, and for that, if you don't want to feel like a patient but still get the right kind of treatment, Namaha Healthcare is here for you, because you get treated like family over here, and that's why I love this place. Thank you so much for such a safe space for us to talk about our problems. हमारे स्पेशली women के लाइफ में जो प्रॉब्लम्स हो रहे हैं उसके बारे में हम बात करते हैं. बट माइंड यू, Namaha Healthcare is a multi-specialty hospital, healthcare place. So कुछ भी concerns हो, you can definitely come here. Dr. Munjaal is here and a team of doctors who are here to help you with any questions. और बाकी अगर आपके sexual health या फिर आपके reproductive health से जुड़े कोई भी सवाल है, then ask me anything with Dr. Munjaal. हमारे शो पर ये सेगमेंट जारी रहेगा. Thank you so much, Dr. Munjaal,
Thank
for
you
being
for
a
having
part
me.
of this.
I'm always happy to be a part of this. Thank you so much.
The pleasure was all mine. Stay tuned to Radio Nasha.
Radio Nasha.